And before we go to this young lady, I have another snap poll question. I'd like you to respond with the sound of applause. Your two choices and answers are yes and no. Do you agree with this statement? Government mandates are the best way to maximize consumer health care choices. Those who believe yes, please applaud. Those who believe no, please applaud. Let's go to this young lady. Step over here, please. Tell me who you are, where do you live, and what's on your mind.
Okay, I'm Carolyn Camo. I live in Weaverville, and my story is that on Saturday, this coming Saturday, I'll be 7 years out from a stage 3 breast cancer diagnosis.
And you're
Thank you.
cancer-free today.
Yes, sir.
Very good.
Thank you. Thank you. And my experience, I think it's great that we're all coming here and talking about our experiences. I felt, unlike some other people who have commented, very unsafe for the last 6 years because my treatment happened at the same time my husband got laid off. He worked in the construction and building field, and it was very hard hit in 2007 and 2008. I went through my treatment. We lost our insurance in the middle of my treatment, and I got on the high-risk pool after I went to a large insurer and learned that it would be over $3,000 a month just for me. My kids are now on Medicaid. My husband has been uninsured, and I was in the high-risk pool at a high rate per month. And also, it didn't cover anything. So my doctors didn't participate in it. There was a lot of problems, and we paid for almost everything out of pocket. Almost half our income one year went for my health care. So I signed up with the Affordable Care Act, went on the phone, and I burst into tears when she said, nobody can discriminate against you anymore because you have a pre-existing condition. So I am making a comment, and my question is somewhat dramatic, but it's real. How many more times are we going to have to walk into grocery stores and convenience stores and see jars? This disease-stricken person, please give. It's just not how things are supposed to be, and I agree, we have to start somewhere. And there was violent opposition to things we consider wonderful now, like Medicare and Social Security.
So Leslie, are we making progress? Are we moving in the right direction? Or
we are. It's not perfect. And you know, I would have liked to see a public option where I can buy into Medicare. I would have liked that choice, because the insurance companies do have a virtual monopoly in this country. They're exempt from antitrust laws, and the only way to get real competition is either unexempt them from the laws or institute a public option where we can buy into Medicare if we so desire, or we can choose a private insurer. I think that's where we need to go. But this is such a big step. My son would have survived had he been alive for the Affordable Care Act. He wouldn't have been denied insurance and then denied care. No, it's not perfect, but it's a great step ahead of where we've been.
I want to follow up with Donald. Do you agree with what Leslie said, or do you have some other issues that you want to address?
I think what Leslie said was, with the insurance companies, that we need to either unexempt them or create another monopoly through a government public option, which I don't think that's the way we want to go either. I don't think anybody will say that what we had before the Affordable Care Act was a perfect healthcare system. It had a lot of problems, and I don't think it needs reform. I don't think that the Affordable Care Act is the way we need to go. There are some things that can be done at the state level, such as reforming certificate of need laws reforming certificate of need laws and allowing other private entities to get into the marketplace, such as church clinics and free clinics, and allowing other doctors to just open up a free clinic if they want to. I think that will provide affordable health care to a lot of people, and that's one of the few basic reforms that we could do at the state level, along with allowing insurance companies to sell insurance across state lines.
Now, before we get to this gentleman's question, I'm going to make things a little more difficult for Cody. I know you're on the hospital side, but this is a second part of what you do. I want to share some statistics with everyone here. According to the Association of American Medical Colleges, we're going to face a 91,000 doctor shortage over the next 10 years in America. 45,000 primary care doctors, and 46,000 surgeons and medical specialists. And we continue to have this phenomenal growth in people aged 65 and older, so people who tend to need more medical care. So can you talk for a moment about the strain that puts on hospitals and healthcare in general when we may have the bricks and mortar in the buildings, but we don't have the doctors?
It is something that we are extremely concerned about right now. Most of the medical students who graduate right now go into specialties. We need specialists, but more than that, we need some primary care doctors. One of the biggest concerns with Medicaid expansion is we didn't have enough doctors to cover it. That was just one of the small concerns. We are trying to do everything we can to make sure that we have the doctors in our state that we need to care for our population, aging or not. One of the reasons that many of your hospitals will buy a practice is because it's either the doctor leaves or we buy the practice so that they can see patients as opposed to doing the paperwork that's required to stay open. So we're very concerned about the doctor shortage, and we're doing everything on the hospital side that we can to make sure that we have enough doctors in our state, but it's not easy.
And one quick follow-up so everyone appreciates how difficult the situation is. According to the Doctor Patient Medical Association Foundation survey conducted in May of 2012, they asked doctors, how do current changes in the medical system affect your desire to practice medicine? 5% said, I'm re-energized. 13% said, I'm unsure, I have no opinion. And 83% said, it makes me think about quitting. Let's go to this gentleman. Please tell us who you are, where you live, and what's on your mind.
My name is Scott Parker, and I'm from Asheville, and I'd like to make a quick comment first. I work at a community health center in Asheville, Western North Carolina Community Health Services. We're signing people up or assisting them with their sign-up process at our health center. Our sister health center, Blue Ridge Community Health Services in Hendersonville, is doing the same. So I just want to let you know the community health centers are another source if you do want to try to have get some assistance in signing up for the marketplace. But I read an interesting article last week, and that showed that North Carolina ranked number 3 in the total number of sign-ups among the 35 states in the country that are in the federally facilitated marketplace. And I wanted to ask our panelists, what do you attribute that to? Why would North Carolina, if only 38% of the population in our state think the Affordable Care Act is a good thing, why do we have so many people signing up in North Carolina?
Leslie, what do you think?
I think people are actually excited about being able to get coverage. My son would have been thrilled to get coverage, and even if you don't think the law is the best thing, I think people are excited at being able to get coverage. And we'll see how it plays out, but I think part of it also is that here in North Carolina, we've made great effort in educating people, and I think we've done a really good job of letting people know that the exchanges are there, that they can sign up, that we have navigators. Blue Cross Blue Shield is out educating people and signing them up. I think we've just got a really good education going on here in North Carolina. And remarkably, none of the 3 states that lead in sign-ups are expanding Medicaid.
And just in a quick follow-up to that, Elon University had a poll conducted November 15th through 18th of 2013, and it asked the public to rank in order what were the most important issues. Coming in at number 1 was health care and the Affordable Care Act at 24.4%. Let's go to this young lady. Please tell us who you are, where do you live, and what's on your mind.
My name is Martha Sachs. I live in Hendersonville. And I, first of all, want to clear up something, an impression that people have all the time when they keep talking about government-controlled health care. I've been on Medicare for many, many years, and nobody tells me what doctor I can see. I can go to any doctor I want to. I do not need a referral as long as the doctor is willing to accept Medicare. People don't understand this. They think government controls it. What is really controlling healthcare is the private insurers who tell you you can only see doctors that are on this panel, and you have to get approval before you can see a specialist, and sometimes we don't let you go to them. So I think people have a very bad impression about what's really going on, and they need to understand it more readily. Another thing I'm concerned about is that I think that the Affordable Health Care Act is a step in the right direction, but it happened as a result of an attempt to try to compromise with the insurance companies, instead of going directly to what they should have done, which is a single payer system like Medicare for everybody. Because with Medicare for everybody, and I have a Medigap policy, but the whole thing, my monthly premiums of both put together are just a little bit now, and I'm very, very old.
No, you're not. You're not.
I'll be 87 in April.
Kind of old.
That's not old, though. And you're going to be with us for a long, long time. We'll be talking about this years from now.
I hope so. But my point here is that if everybody had this, and the Medigap policy is not that expensive, my whole thing with all of this, and at my age, is still under $300 a month. And I've had surgeries for which I have not had to pay anything out of pocket.
All right. So this young lady made some good points. But Donald, are there aspects about Medicare that we should be concerned about? Because the Medicare trustees have given some warnings, haven't they?
Well, yeah, I can't speak about Medicare as well because a lot of the Affordable Care Act stuff has really come down on the Medicaid side. But she makes a point that she can go to any doctor that she wants, and she can. Medicare, doctors are much more willing to accept Medicare. But when you go to Medicaid, you find a lot more doctors and clinics are less willing to accept Medicaid, which does limit how many people you can go to. There are payment problems with Medicaid. The rates are back, and it ends up as a net loss to the doctor. Doctors do a lot of good, and they're not there to cause any harm. They're there to help their patients, but they're also there as a professional trying to make a living. And they shouldn't be forced into having to take on a system that pays them less than the services they've rendered.
And I know you have a quick follow-up.
Yeah, one of the biggest costs I've heard there's been a huge increase in the cost of medical care over the last 4 years. One of the biggest costs, if not the biggest cost, has been the cost of medication, which has been rising outrageously. The other thing that I'd like to know is why nobody is doing anything about the severe over-medication that is going on, not just in long-term care facilities and hospitals, but with people in general, and especially in those cases where in these cases where they are over-medicated, the doctors who are doing this over-medication have financial connections to the special pharmacies that only supply long-term care in hospitals. This is a conflict of interest. There should be a law against it, and there isn't. I've called the Inspector General of Kathleen Sebelius' office to talk about this, and they said they can't do anything because the law says they cannot interfere.
All right. Well, let me follow up with this. Alec, does Blue Cross Blue Shield have any kind of policies regarding just conflict of interest in general regarding any of your practitioners?
As far as the practitioners having
any business
contracts
relationships with referrals or medication or
Right.
anything? Broad question.
with the contracts that we have with the doctors, I'm not familiar with that part of it. I can say that we always try to negotiate the best rates we can for both medication and with the doctors themselves, but the doctors with pharmacy companies, I don't know what the contracts stipulate as far as that is concerned.
Okay, and I want to just do a quick follow-up, and again, News 13 just sharing information. While every poll shows that Medicare recipients are very happy with Medicare, there are some concerns according to the Medicare trustees, and according to their 2012 Medicare Fiscal Health Report, there's an unfunded liability of $38.6 trillion over the next 75 years, and there are concerns at the current rate that Medicare will go bankrupt before we can take care of all of our outstanding debts and concerns. So there are some issues over the horizon. Let's go to this gentleman. Please tell us who you are, where you live, and what's on your mind.
My name is Bruce Joba. I'm from Etowah, and I retired down here in 2005 from Western New York. I worked for a large photographic firm in Western New York. It'll remain unnamed. And they filed bankruptcy in 2011, and in 2012 they announced they were going to take health care away from the retirees. So in 2013, I had to pay the full shot for health care for my wife and myself. I'm a legacy customer of Blue Cross Blue Shield. I went to your presentation at Biltmore Park in September. I was able to get on the healthcare marketplace in mid-November, successfully applied, and I qualified for the premium tax credit. But it's taken me 5 weeks to finally get my new insurance card and new policy. And I was wondering if this is a common problem with Blue Cross Blue Shield and the exchange, and what's being done to correct it.
What do you think, Leslie? Are you familiar with this?
I've heard about it. I've heard that, you know, it was overwhelming for some people. There have been some computer problems. There have, you know, but it is evening out. It's shaking itself out, and it's getting better. You know, whenever you launch something as massive as healthcare reform, there's going to be bugs, and this was one of them. And from what I understand, it is shaking itself out pretty well.
Quick follow-up with Alec.
First off, let me start off by apologizing. We know that this has been complicated and it was overwhelming for a time. Right around mid-December, the system, the marketplace finally started working at a much better rate than it was before. So we had a massive influx of applications. And then there's a communication between the government and our site, and there's always hiccups with that. We've been working overtime. Our staff is working until midnight most days, Saturdays as well. So we're trying to get this resolved as soon as possible. It's complicated, it's new. We're trying to do the best we can with that, but there are going to be hiccups at times, but we do think we have a handle on it now, so the turnaround time has been reduced significantly.